Hi everyone. I am here to give you my 28-week pregnancy update. And I also wanted to continue on with the theme about embarrassing symptoms because I remembered a couple more kind of like too much information, gross pregnancy things and postpartum things that I wanted to share with you folks. I am a little melty and my hair is a little messy, which is normal for my videos. It is very, very hot in my house today, and I had to turn off the fan to record this video, so hopefully the audio is okay, because there are fans going on in the rest of the house. Okay, so first thing is that 28 weeks is my first week of my third trimester, so that is very exciting. If this pregnancy proceeds the way that my pregnancy with Oliver proceeds, perhaps we will be meeting this baby in about 10 weeks. But that doesn't necessarily, one pregnancy doesn't dictate how another pregnancy might go. So it could be less time, it could be more time. I really do want to make it past 37 weeks because if I go into labor before 37 weeks, I have to give birth in a hospital. Those are the rules here. So as long as I get over 37 weeks, I'm sorry, this is so distracting. I gotta fix this. I can have my baby at home, which is what I want to do. So I will talk about the embarrassing symptoms really quick. So I have not had this so much in this pregnancy, but I remember when I was pregnant with Oliver, I peed myself quite frequently. I peed myself in the movie theater. I peed myself in the car. I have peed myself in this pregnancy as well, but I feel like it was more frequent with Oliver. And I think the reason why it is less frequent this pregnancy is because I'm so much more aware that go pee. Like if you think you need to go pee, go pee. If you don't think you need to go pee, go pee. And just like minimizing the risk of peeing myself more than when I was pregnant with Oliver. I, again, am on the exercise ball. I've been finding this very helpful for relieving back pain. So if you're pregnant and struggling with back pain and you have to work at a desk a lot, like I do, I highly recommend getting yourself an exercise ball because it helps engage your core, which is really important for giving birth, and it also is just like way more comfortable. I do sometimes have to take breaks and sit in a normal chair because being in your third trimester and pregnant, it's hard to be on an exercise ball all day, but you feel so much better than if you were sitting in a chair all day, but your feet don't swell like you would if you were standing all day. So it's kind of like the best of all worlds. So that's my tip of the day. The other like embarrassing, gross symptom thing that I wanted to share is actually a postpartum thing. Yeah. The other thing that I wanted to share about pregnancy is leaky boobs. When I was pregnant with Oliver, my breasts leaked a lot, and I was so bosomy that I couldn't wear a bra, so it was always just like leaking all over the place. And that's a postpartum thing too. It's even worse in postpartum. And it's not something that I find particularly embarrassing, but I know that other women do because I just am like, it's baby food. I just have baby food on me. It's not a big deal. And again, with this pregnancy, I just don't have that as much. I am leaky, but I think it's not as noticeable, or is something that I'm not really thinking about because I'm also breastfeeding at the same time, like during this whole pregnancy. So yeah, I don't know. It's not as just leaky as it was with Oliver because there's somebody to drink the milk right now. Anyway, so postpartum, the things that I wanted to say was during my early postpartum with Oliver, I pooped myself. I just I guess didn't really know what was going on down there. Couldn't really sense that I needed to poop, and I pooped myself. And I was holding Oliver and I was nursing, and I just remembered that I was like, what do I do in this situation? Because it was all over me. It was like diarrhea and it was all over me. And I was like, if I try and move, I'm going to track it all over the house. Do I just wait until my husband comes back inside to clean it up? I'd really like it cleaned up before he comes inside because this is really embarrassing. Keeping in mind that he had just watched me give birth, so I don't know why I was embarrassed by it, but yeah, so that was something gross, and that is actually something that I was very embarrassed And then the other thing is postpartum, you wear diapers, or at least I did. I wore diapers, and then I put a padsicle, which is a frozen pad with like some healing ointments in it. I use aloe vera and witch hazel, and then I froze those before, and I actually have extras left, so I'm going to use them for this pregnancy too. So I don't actually need to. I don't have to put out that expense or effort to make new ones. So I put that in my diaper, and then I just wear my diaper around. It was really great. So this isn't really, it's not really a symptom or anything, but I just like would need to pee. Again, like the need to pee probably actually increases in your postpartum because your body is getting rid of excess plasma because you don't need as much blood in your body anymore. So you kind of pee a lot. And so we'd be walking around like, you know, staying mobile and stuff like that. And I just need to pee. So I just pee in my diaper. So that's it. Kelly would be very embarrassed. My husband would be very embarrassed by that, but nah, I didn't really care. I was like, this is just really convenient. Okay, so talking about this week, I'm sure this video is going super long, so I'm going to try and keep this part concise. So I had my midwifery appointment yesterday. I had it with my primary midwife from my first pregnancy with Oliver, and that was so exciting. I have my primary midwife this time was also my midwife in my first pregnancy, but she was my secondary. So now it's swapped. So it was really nice to see her again. She's doing very well, and she was very excited to see me as well. I am measuring about a week behind, which means one of three things. The first thing, it means nothing. The second thing, maybe my dates are off. This is very highly unlikely because I keep really good track of my cycle, and my dates were based on an ultrasound. The third option, and probably the most likely, is that I just am having a small baby. I have not gained as much weight as I did with Oliver at this juncture, though I had extra weight on my body that I didn't have when I got pregnant with Oliver beginning this pregnancy. So I think it kind of equals out, but that is just a note, is that I am small. Lots of people have been saying, ooh, maybe that means you are having a girl, but I don't think that there's any correlation or thing that says that girl babies are smaller than boy babies. I think the average is 7.5 pounds regardless of what genitals you were born with. But who knows, maybe it's a girl. Oliver thinks it's a girl. My blood pressure is 118/64, which is great. That's exactly where we want it. Baby's heartbeat is between 140 and 150 beats per minute, but we couldn't really get a very good read on it because all of my babies hate the Doppler. The entire time I was pregnant with Oliver, he constantly rolled away from the Doppler and kicked the Doppler away, so it was really hard to get a proper read on him. But the midwives always knew that he was really healthy because he was moving around a lot. And this baby has been the same. This is not the first time that the baby has scuttled away from the Doppler during this pregnancy. So that's really great as well. With COVID-19, actually having had just a spike this week in terms of new cases in my area, there are still lots of precautions going on. So when you go into the hospital, you can only go yourself. You can't have anybody with you. So my husband has not been able to attend any of my prenatal appointments, though he was able to come to the ultrasound, which was really great. When you come in, you have to do screening questions, which is really interesting because they also make you do screening questions over the phone before you can come into the hospital. So it's like a double precaution. They make you sanitize and mask up before you're allowed to go in and see your midwife. And then once you get there, you wait outside. She has to mask and glove up, and then you go in, or sanitize up. I don't think she was wearing gloves. Yeah, so that's what's going on. The other thing that's going on is that normally they lend out birth pools for women that are having home births, and they are not doing that. That is one of the decisions that the health region made to help protect moms. Now, it's really interesting because from my knowledge, COVID does not live on surfaces, so it seems really strange that they would say you can't lend out these pools. and especially because you would sanitize them, and there's a liner that goes in them too, and you throw that away. So you throw the liner away and then you would sanitize it before you would give it to anyone else. But I guess it's just more, again, just like so many people having interactions with things. I'm not really sure. But the exciting thing that my midwife told me is that many women have opted to continue to have in their birth plan that they're going to have a water birth, and they've purchased birth pools. So what's happening is lots of these women are recirculating their pools, which is exactly what the health region didn't want, but they're doing it of their own initiative. So they're either selling their birth pools after they're done with them, they're lending them out to people, or they're renting them out for a fee. So she said that she's keeping a list, and she'll keep me on that list. And when somebody has a baby that wants to give up a birth pool around the time that I'm giving birth, she'll get me a pool. So that's really exciting. I'm really happy about that because water birth is my preferred method of birthing. I really found that to be a great way to give birth to my son. The other really exciting thing that happened in this appointment was my midwife reviewed my birth history with me. And it's so crazy because you remember the birth of your child so much differently than the way it actually happened. And it was really great to hear just like straight out of her log what she had written down and what she had recorded. So I wanted to share with you what happened when Oliver was born. And the reason why I want to share this with you is because one of the things that she said to me was that pregnancies and births tend to follow the same trend. So if you had a quick, fast labor the first time, it's probably going to be quicker and faster the second time, and so forth and so on. That doesn't happen for every woman, but she said they tend to be the same or quicker, not slower. So what happened on the day that I gave birth to Oliver was this. I called my midwife. Actually, I had my husband call my midwife at about 5:30. She was attending another birth. There were many births that happened that week. So she didn't get to my house until almost 7, I think. Yes, I'm trying to remember the times because it's important. So when she got to my house at 7, she checked me and I was 6 centimeters dilated, which means she thought I still had quite a ways to go. By 8, I was already starting to have the urge to bear down, and I was feeling that natural push sensation. So it's not me actively pushing, it's just your body pushing the baby out. Some women do what's called purple pushing, which is when you're like trying to push the baby out. But with the hypnobirthing preparation that I did, it's just about listening to your body, and your body like contracts the baby down and out of your body anyway. You can do a little bit, like you can do a little bit of purple pushing to assist it, but it's really not necessary. And why would you tire yourself out doing that when your body's going to do it anyway? Again, for some women, other women do really struggle and need more assistance in birthing their babies, whether that be by forceps or by episiotomy or by cesarean. So already, she's only been there an hour and I'm already like, I'm getting this baby out of me. So she called the secondary midwife to come and attend the birth. She got there at 9. So now this is about 2 hours since my first midwife got there. And at 9, my first midwife was already able to see my baby's head coming down. So it was very, very quick. And then my son was born approximately 30 minutes later. So that means that I went from 6 centimeters dilated to fully dilated in a very short period of time. And it was a very short period of pushing and very limited pushing as well. So there's 2 things that are interesting about that is that my midwife was like, you know, make sure you call us because of how quick that was, and that my secondary midwife almost didn't make it to the birth in time. The other thing was that she really complimented how well I did and really encouraged me. So that was really nice. And she said that for a first-time mom, that was really, really quick, and I handled it very, very well. I did it unmedicated. So the only pain relief I had was my brain. And so she complimented me, and that's really great. So it just is really encouraging to me that I'm on the right track. I just followed the same preparations that I did with Oliver, maybe even amping it up a little bit more and doing a little bit more hypnosis and a little bit more just mental preparation. The other thing, though, that I'm thinking about is that when you dilate that quickly, it can be very intense. So that's something that I need to put into my visualizations and into my hypnobirthing practice, to keep in mind that if my labor, the second phase of my labor, the first stage of my labor was quite long. The second stage of my labor is that short, to remember that that is a very intense period of time, and to turn inwards and just to do a lot of preparation with thinking about that. So that is my 28-week update video. I hope you found it helpful and encouraging, and I'm so excited to share the rest of this pregnancy with you. I am going to record a video for a previous week to share with you, and my apologies if this video is a little long. I had a lot to say this week. Thanks so much for tuning in. Please subscribe and follow me on Instagram and check out my blog.